Hello and welcome to another episode of the Reach Prevention of Targeted Violence podcast, where we explore various dimensions of violence prevention through insightful conversations with experts and community partners. I'm Diego Garcia Tovar, your host and a member of the Reach Project team, and I'm excited to share this time with you. Crisis intervention is vital in preventing targeted violence, as it allows for immediate response to potentially dangerous situations, de-escalating them before they escalate further. By providing timely support and resources to individuals in distress, crisis intervention helps address underlying issues that may lead to violence. Moreover, it fosters safer communities by promoting proactive approaches to identifying and mitigating risk factors associated with targeted violence. Joining us today is Dr. Rebecca Cole. Dr. Cole is a postdoctoral scholar at the University of Texas, Rio Grande Valley at Edinburgh, Texas. Dr. Cole, thank you so much for your time today. Can you tell us a little bit about yourself?
Sure. I'm a licensed clinical social worker supervisor, and prior to my current position as a postdoctoral research fellow in a school of social work at University of Texas, Rio Grande Valley, I was a clinical social worker working on a co-responding mental health crisis team in Houston, Texas, where I was paired with a law enforcement officer, and we would respond to mental health calls for service in the community. So the law enforcement officer and I would go out and I would assess and they would do their police investigation. And then I went to school. I completed my PhD, and my research interests now are a little bit different as I focus on online romance scam intervention, but also I look at social worker, professional development and well-being, and also interested in mental health crisis intervention.
Thank you. From your perspective, what are the fundamental principles or goals of crisis intervention?
With our particular role in crisis intervention with law enforcement, the goals were to divert people away from jail and criminal institutions and to get individuals who are in mental health crises connected to mental health services that were available in the community. The other goals were to reduce injuries and risk of harm and death to persons with mental illness, but also to reduce the threat of injuries to law enforcement too. And through doing this training and work of crisis intervention, one of the aims were to increase the dialogue between persons with mental illness in the criminal justice system, and also overall to decrease the stigma about mental illness in the community.
Thank you for sharing. How does crisis intervention differ from other forms of mental health support?
This particular version of crisis intervention, it's different because one is we were, as a clinician, I was paired with a law enforcement officer. And so we would go out to the person in their environment, where often they would have their closed systems around them for support, their support systems. And I would complete my biopsychosocial assessment and mental status exam on site with the individual there, as opposed to having to transport that person or that person having to go to an office for mental health services. So in Texas, crisis intervention regarding mental health, if somebody's a threat to themselves or a threat to other people, that law enforcement are the only authorized parties who can facilitate an emergency or coercive mental health hold. There is another mechanism of going to a magistrate to obtain a mental health warrant, but the emergency detention order that law enforcement can facilitate is designed for if there's an immediate threat of harm for somebody, they're threatening themselves regarding others. And then that same policy that outlines law enforcement's role also includes that they have to take them to a mental health facility to be treated. And so I think this differs too, is we're really aiming to get people connected to services, but also making sure that we're educating their support systems around them about what resources are available in the community, just what to do if there's a future crisis, and how to ensure the safety of everybody there.
That's interesting. Can you please tell us, how do you assess whether an individual involved in a crisis is at risk of committing acts of violence? In other words, what indicators or behaviors do you look for that suggest a crisis could escalate into targeted violence?
Yes. For me, the staple of determining if somebody was at risk was through my assessment, and my assessment has several parts. I review their history, which included any mental health history. It could also include any history of interaction with law enforcement. We look for patterns of violence, a history of violence. And then we review the circumstances of the call. Was violence involved? Were there threats of violence to themselves or others? What is the presentation of this individual? Other signs and symptoms of psychosis, signs and symptoms of acute intoxication. I assess their insight. I assess their judgment. I'm looking at different risk factors. I look to see too, does this person have access to firearms? And if, have they made threats that they would have killed themselves, so that they have access to firearms? Were those threats, intertwined? And just trying to see what risk exists within that person in their environment.
In your opinion, what specific crisis intervention strategies are most effective in de-escalating situations involving targeted violence?
I think it's important to have a non-judgmental, unconditional, positive regard attitude when you're out there, when you're working with individuals, because there's so much stigma involved. You have to exercise empathy when you're working with individuals who are in crises, because you don't exactly know what's happening, what they're experiencing, until you get to develop that rapport with them. I also found it to be very supportive to be transparent with everything that's happening. So if we get a report that somebody was threatening to kill themselves on Facebook, I will be very transparent, saying, I understand that you had posted on Facebook that you were going to kill yourself. This is why we are here. I'm going to complete an assessment, and then we're going to determine if we need to transport you for further care. And so just step by step of what's going on, I make sure to let the person know who we're interviewing so that they can understand what's happening in the process. I'm also very transparent about the law, because there's some confusion. Since a law enforcement officer is out there, an emergency detention order is a civil rights hold. It is not a criminal hold. There's a lot of confusion with people believing that they're under arrest, when in fact we're just taking them to a medical facility or a mental health facility to be assessed. And then be willing to be collaborative if possible. It is very important to exercise continuity of care. So I want to call their psychiatrist. I want to get background information in that moment. And it's a very quick situation, because you're going like bum, 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 and wanting to get people connected. So it's very fluid and very fast, but you do need to take time to speak to their support system, speak to their treating physician, their treating therapist, to make sure you have a thorough and reflective background information on this individual so that they could get the best treatment as possible.
Can you please share with us, how would you ensure clients feel safe and supported during a crisis intervention?
I think it's very challenging to make sure they feel safe and supported, because they often feel targeted, and it's very stigmatizing because it's a law enforcement response when we are out on the scene. And it can be very conflicting ideals that, you're sick and you have a mental health crisis. And then as a result, police are the ones that have to come and take care of you. So again, we try to work and make sure they understand that as us on that team, we're very specific to help facilitate mental health treatment. We're not there. Our goal is not to take somebody to jail or to arrest them. It's simply to get them connected to treatment. So It's a scary process. And I believe that they've had history before with law enforcement. They may hold some cultural mistrust with law enforcement, with the medical community, with mental health community. So I try to provide transparent communication throughout the time until they're accepted at the facility. I work with them to try to make it as collaborative as possible. So if they say, I really prefer mental health treatment at this place versus this place, we'll listen and try to work with them to accommodate their requests. And also, when we get there, I provide clear and concise report to the medical team to make sure that any requests and any important information is conveyed about what has transpired during our interactions.
Let's discuss the roles that cultural and community dynamics play. How do cultural and community dynamics influence your approach to crisis intervention in situations of targeted violence?
I think one of the things, I worked in Houston. So in Houston, there's over 100 different languages spoken, and it's a very diverse community. So it was important to have cultural competent law enforcement officers and clinicians on the scene. So especially number one was finding somebody who spoke their language of origin as necessary. And then understanding that with different cultures, family may be more involved than other families, and making sure this is a person-centered approach to ensure that we're supporting the needs, whether that is something to do with language or background or religious or spiritual culture. We want to make sure that we're incorporating that into this process to respect the needs of the individual. Also, research suggests that it is important to help support mental health treatment along the way.
Now we're going to switch gear to look at collaboration. In your experience, how do you collaborate with other professionals, for example, law enforcement and medical staff, during a crisis intervention related to targeted violence?
I provide communication that's clear, and I try to make it very clear and not editorialize it, and making it very transparent to everybody to make sure that they understand. And during my assessment, I've learned some specific information that is relevant to what's going on. I make sure I communicate that to everybody there. If I observe any triggers or I witness any triggers, I can convey that to law enforcement or to the medical team. Or if I see any signs of acute intoxication or notice anything, even in the environment, if we see, like, we're there for targeted violence and, I notice that they have tons of pills just spilled over somewhere, making sure I'm conveying that to everybody to let them know, hey, this could be a concern. Maybe this person overdosed. Maybe there was something else going on. But communication is probably the biggest way to collaborate during the crisis intervention.
Let's talk about training and education. What training or education has been most beneficial in preparing for crisis intervention work in violence prevention?
In general, I believe it's my education as a social worker, because we are educated and trained to focus on our cultural humiliation, to, understand that we need to continue learning about different populations and different groups of individuals. Clinically trained this person and environment approach to understand that it's just not the person, it's just not the illness, but it's also everything that's happening around them in the background, and to support social justice. I think professional training, one of the trainings that I found most useful was just a mental health first aid training. I thought that was very supportive. And I also thought that was easily translatable to the community persons who don't have professional training in mental health.
Thank you. We value your perspective. Can you share what personal skills or attributes do you think are most important for professionals working in crisis intervention related to targeted violence?
Yes. So I think it's important to have some adaptability and flexibility, because you have to adapt to different environments and circumstances that may make you as a clinician uncomfortable or might elicit some bias in you. I think it's important to have a really strong support system and a professional support system that supports your practice and your autonomy as a clinician. And then they can also give you guidance and supportive critical feedback. I also think it's important to have space to debrief because you're going to experience moral distress and moral injury and these ethical dilemmas. And you have to have a space and supportive space to debrief and process that. I think you are going to witness things that could be perceived as disturbing or experience critique from individuals and families because it's a crisis and families may not agree with what's happening, or the person involved may not agree with what's happening, and they can be at times frustrated and will communicate that to you in ways that may feel personalized. And so I think it's good to have a support system around you to work through that. And another thing too, I found like with social work, our social work ethics don't necessarily align with law enforcement's ethics or nursing ethics or the medical team ethics. And so there can be some conflicting feelings along there because, we're as a social worker committed to upholding social justice, and there will be events and times where things do not feel just. And so it's just having good space around you to support you with that.
We appreciate everything that you have shared with us so far. Before we conclude today's episode, what best practices would you recommend to professionals engaging in the work of crisis intervention to prevent targeted violence?
I think it's important to have some very targeted professional development training on crisis intervention, but also be familiar with collaborating, work with other community partners, whether that's working with law enforcement, if you're just a clinician in the community, working with law enforcement, working with different psychiatry offices, different supportive agencies for like primary needs, to know what those resources are in the community. I think it's important to do a lot of reflection work to address your biases, and you'll develop different ones along the way. So it's really important to know that and to process through that. If you're wanting to work with law enforcement, like on a collaborative response team, in Texas, it's important to remember that, again, that law enforcement are the only ones who can facilitate these crisis intervention holds. And so these teams primarily are facilitated through cooperation between the local mental health authority and the local law enforcement. And I've only seen them in the larger metropolitan areas of Houston, San Antonio, El Paso. And so that means as a clinician, that means you're going to have to work for the mental health authority. And I had to be a fully licensed clinician in order to be on this team. And that was really important too. I think the other part is doing this work is to make sure that you're aware of what your ideologies are and be comfortable and strong with the work that you're doing, because I have encountered other social workers who believe, in abolition, who are abolitionists, who believe that, social workers shouldn't be working with law enforcement and crisis intervention because of the history of oppression. And I recognize their point of view, and their point of view is valid, but I also believe that for persons and families who are in crisis intervention due to a mental health crisis, it's so critical to have competent mental health clinicians there. And I think that this corresponding team framework is an important part of our mental health community.
Thank you so much, Dr. Cole, for your time. We appreciate all the insightful information you have shared with us, and that concludes today's episode.
Thank you.